my shoulder or anything? There's lots of steps. take these also?
Yeah, I think so. Yeah, let's just grab the raw.
Or do we have enough here in this row?
Yeah, there's 10.
Oh.
You got 10, right? Tickets? Like,
I don't know how many I have.
do you have a ticket for Tracy?
Do I need one? They didn't ask for any tickets.
Oh, she's not there anymore? Okay.
Where's Tracy? Here, do you guys want to go in?
Any minute.
Why don't you go in?
Here, I'll let you guys put in so I can go wait for her. Should I be on the Amazon?
No, just go in. Grandma didn't make it?
No, where's she? She had a funeral to do. She does this funeral all the time. Yeah.
Where are you sitting down there?
I'm at the other end. Yeah.
Okay. I'm gonna put this stuff in. I'll sit with you.
No, I told you yesterday when she got here.
Oh, okay. Cool. When did you get into town?
Last night?
Oh, really?
Yeah.
Are you staying at Grandma's?
Yeah.
Oh, cool.
Yeah.
All right, you're coming tonight, of course.
Of course.
Right,
Yeah. I came because,
Right,
you
right.
know,
Good,
yeah.
good. Come on, put this stuff down. All right, put it here. I have to.
I just wanted to make you aware that at the beginning of this microphone is the one that's live streaming.
Oh, okay.
So we should be talking into it. Look at how awesome she is.
Anything you share will be on the internet. Just
I parked myself all the way at the end.
All right, here, I'll give you a real hug now. Thanks for coming to town. You go say hi to Harper?
I didn't yet.
Oh, well, she's probably making the rounds. So.
Yeah.
How are
Probably
you?
make it down that way.
Huh? She'll what?
She'd probably make it down that way, right?
All the way down there? Or here?
Down that. Well, maybe I should go get my stuff and sit by you.
No, she'll make it. I'm not going to be holding her. She'll be over there with the grandparents the whole time. So you,
He used to see her every day.
all right, I'll come with you to find Tracy.
Oh, well, she hasn't texted me that she's here yet, so she's probably parking right now. Oh, I just...
Remember Tiffany? That's this. Remember Tiffany? They put us on Rod.
Good afternoon. I welcome you to Metropolitan State University's Doctor of Business Administration and Doctor of Nurse Practice commencement ceremony. It is a pleasure to welcome the families and friends of our degree recipients as you join Metropolitan State deans, faculty, students, staff, and other special guests on a day when our 19 doctoral graduates will bring the number of Metropolitan State University alumni to 41,473. I now introduce President Ginny Arthur. Please welcome President Arthur.
Thank you, Provost Borman-Young. Graduates, it's a privilege to serve as Metropolitan State University's president and an honor to join you this afternoon. We come together to recognize your academic achievements and to celebrate your reaching this important milestone in your lives. As a university whose primary mission is to make an exceptional learning experience accessible to adult learners like you, we know that many of you have juggled work, family, and community responsibilities while pursuing your studies. We are extremely proud of you. As Metropolitan State graduates, you will join a growing and distinguished body of alumni who are leaders in business, government, education, the arts, law enforcement, human services, healthcare, and many other fields. We are confident that the preparation you have received at Metropolitan State University will equip you to be leaders, both in your careers and in your communities. As we begin our ceremony, I would like to thank Beacon Hill Brass for our music this afternoon. We also recognize our special guest, Ms. Tanae Wells, Alumni Association President, who has joined our celebration this afternoon. We have several of our deans with us this afternoon, and I would like to recognize them. Dr. Carl Holding, Dean of the College of Individualized Studies. Dr. Cap Louie, Dean of the College of Management. Dr. Renee Antrop Gonzalez, Dean of the School of Urban Education. Dr. Judith Graziano, Interim Dean of the College of Nursing and Health Sciences. Dr. Frank Schweigert, Interim Dean of the College of Community Studies and Public Affairs. Dr. Shonda Kraft, Associate Dean of the College of Community Studies and Public Affairs. I also want to recognize our Associate Provost for Student Success, Dr. Doug Knowlton. Thank you all for your dedication to Metropolitan State University and its students. Our distinguished guest speakers will be introduced throughout the afternoon. Other platform guests and university leaders are listed in your program. I'm keenly aware that the quality of our students' academic experiences relies not only on our students' energy and academic efforts, but also on the professional commitment of our dedicated faculty and staff. Several of our residential faculty, community faculty, and staff are with us today. Graduates, please join me in thanking these colleagues for their dedication to your academic and future success. Faculty and staff, will you please stand? I now invite Ms. Tanae Wells, President of the Metropolitan State University Alumni Association, to bring greetings on behalf of the university's Foundation and Alumni Association Board.
Good afternoon. As president of the Alumni Association, I'm honored to congratulate each one of our graduates this afternoon. You have done something very special, and today you should take a moment and thank yourself for all the hard work and your perseverance. Nelson Mandela said, "It always seems impossible until it's done." On my own academic journey, I cherish those words every time I had to stay up for 48 hours to write that 50-page paper or complete the 10th collaborative team project. Somehow I got it done, and today I stand with you as you should pat yourself on the back or wrap your arms around yourself because you did it. Over 40,000 have graduated from Metropolitan State University since 1971. We are all different, but we have one thing in common. We needed an education that prepared us to succeed in life, and we got that at Metro State. You are the next generation of leaders, and I have no doubt that you will go far and live the lives that you imagine. Strive for big, meaningful, and audacious goals. Nelson also said that education is the most powerful weapon to change the world. This is your moment to commit to doing your part to make the world a better place, because that's what Metro State alumni do. As an alumni, you have an important role in helping to shape the future of Metropolitan State University by representing the views of its members and contributing to building an engaged and supportive alumni community appropriate for this world-class university. Today and always, I ask you to serve, to engage alumni in all aspects of the university, to serve as an ambassador and advocate for the university, to provide feedback and counsel to the university, to generate financial support, even if it's only $10 a year, and to participate in government and assist with student recruitment, both directly and indirectly, and to serve as a resource on a talent pool for the faculty and for the staff. I will end with a quote from one of my sheroes, a woman named Etty Hilson. Become simple and live simply, not only within yourself, but also in your everyday dealings. Don't make ripples all around you. Don't try to be interesting or keep your distance. Be honest and fight the desire to be thought fascinating by the outside world. These quotes from these amazing people have helped me see that I am more than the circumstances that I come from. And they have motivated me from the beginning of my learning until today. And I hope they do the same for you. Congratulations.
Thank you, Ms. Wells. I invite Dr. Kat Louie, Dean of the College of Management, to bring greetings on behalf of the college.
So, on behalf of the 2,400 students and 240 faculty in the College of Management, congratulations to all doctoral graduates. You're here today as a result of your initiative, your intellectual curiosity, and support. Support from classmates, faculty and staff, friends and family. So in addition to congratulations, I would also like to extend a heartfelt thanks for all who supported you on your journey. It's a journey of becoming. When I went through my doctoral program, I had a plan, I had structure, I had a schedule, I could see the end goal, and I articulated it as getting my doctorate. At the time, a revered faculty member told me I had it all wrong. He said, "Your goal, Kat, is to become a doctor." Today marks the day that communicates to the world that you have become a doctor in your discipline of business administration and nursing. You have earned your doctorate. Well done, graduates.
Thank you, Dr. Louie. I invite Dr. Judith Graziano, Interim Dean of the College of Nursing and Health Sciences, to bring greetings on behalf of her college.
President Arthur, distinguished guests, faculty, graduates, family, friends, and volunteers, on behalf of the College of Nursing and Health Sciences, I bring you greetings and a warm welcome to this year's doctoral commencement ceremony. Last spring, we graduated our first Doctor of Practice class under a former college structure, the College of Health, Community, and Professional Studies. This year, we have another first. The first DNP graduates under our new college structure, the College of Nursing and Health Sciences. Congratulations to this group of first graduates. The mission of the College of Nursing and Health Sciences is to prepare graduates to enhance the health of underserved and diverse populations. Shortly, we will hear, as each graduate is recognized and hooded, how these graduates turn this mission into a reality. One student engaged in a project intended to improve care to individuals living with diabetes at an international urban clinic, and another student's project was designed to provide culturally appropriate diabetes prevention education to a group of Somali women living in South Central Minnesota. Another student chose to assess health and wellness needs of undergraduate students at an urban art and design college. Another investigated using a patient navigator to reduce patient no-show rates at a clinic serving culturally diverse and underserved individuals. Yet another project was aimed at HIV prevention at an urban public health clinic. One can certainly see a trend here. I have every confidence that this group of graduates will continue to enhance the health of underserved and diverse populations, which will improve the lives of many and make all of us here at Metropolitan State very proud. Congratulations.
Thank you, Dr. Graziano. I invite Student Senate President Debo Hussein to bring greetings from the Metropolitan State University Student Senate.
Good afternoon, doctoral class of 2017. My name is Debo Hussein, and I'm the president of the Student Senate of Metropolitan State University. On behalf of the Student Senate and the student body of Metropolitan State University, congratulations on your phenomenal achievements. Although my opening remarks will be brief, I promise to make this a tribute to my lovely mother who was among this prize group of graduates. For starters, I promise she's my mom and not my sister. I don't know where to even begin, but I know that many of you in this crowd can relate. Whether you are the graduate or part of the graduate support system, this is for you. My mother, like the graduates here, is a full-time everything for me, my family, community, and practically the world. Aya, you've taught me to be strong and resilient, to hold on to my values and live in my truths. You've taught me to never lose sight of my dreams. You've taught me that there are a million routes to get to where you want to go, so try every route twice. You've taught me to keep fighting, even when all the odds are stacked against me. I learned all of this watching you gracefully struggle through full-time nursing school, graduate edition, work, and community involvement, while also being a full-time mother of 4, wife, and daughter-in-law, and so much more to the individuals you interact with daily. This is a story many graduates can resonate with. You stretched and bent yourself in ways that I thought only molecules could, yet you still gave everything and everyone 110%. You went with the flow, and even when your mind and body were ready to clock out, you carried on and never once complained. Never once said, "I'm tired," or "maybe after I rest." Thank you a million times over for showing me what persistence, compassion, dedication, and determination looks like. I've seen you grow in so many dimensions my entire life. You sacrifice so much, and even though 1 minute isn't enough, just know that you'll always be my superwoman. Graduates, I know this is exactly what everyone in this crowd who is cheering you on feels. Even though I didn't call you all out by name, I know that to this audience and to the world, every single graduate is a superhero. Completing graduate school is not an easy task. Both my parents are graduating this spring with DNP and DBA degrees. So trust me, I know. The insanity that you've gone through is unfathomable. This degree is for all the sleepless nights where you had papers to write, discussions, quality improvement projects, or SWOT analysis, or whatever else kept you up at night. This is a phenomenal milestone. But with these degrees comes great responsibility. Please come back and give your beloved time and share some of your wisdom. Congratulations, class of 2017. We look forward to all of your wonderful contributions as Metropolitan State University alumni.
Thank you, Debo. All of our faculty and staff were recognized earlier in the program for their contributions to our students' successful academic experience. I would now like to bring your attention to pages 7 through 11 of your program, where we recognize our retirees. David Bouchard, Kim Dobert, Eduardo Gutierrez, Roger Israel, and David Means, on recommendation of their colleagues, have been granted emeritus or emeritus status. We especially recognize today David Bouchard, who is with us today. David is retiring after 35 years with Metropolitan State. I suppose you could join me in thanking all of the emeritus faculty and staff for their service and dedication and support of our university mission. Or we'll just thank Dave again. At each commencement, our featured address is presented by one of our graduating students. Speaking to us this afternoon on behalf of the doctoral program students is Rachel Lundbo, Doctor of Business Administration.
Congratulations to the doctoral candidates receiving their degree today. Today we reflect on the path that has led us to this moment. As I reflect upon my own journey, one word comes to mind: thankful. You're probably saying to yourself, of all the words you could have come up with, that's what you came up with was thankful? Yes, you heard me correctly. Today I'm thankful. First, I'm thankful to have finally completed this journey. It's been a long and challenging road. For myself, that meant driving 600 miles round trip while pregnant and then with a baby to attend class every 2 weeks or every other Saturday for 2 years. For you, it may have meant of giving precious time with your friends and family or putting other goals and hobbies on the back burner in order to focus on your studies. Whatever has caused you the most challenges during this journey, now is the time to be thankful that this chapter in your life is done and a new one is beginning. Second, I'm thankful for all the people who helped me through this journey, including our spouses and partners who put up with us when we were stressed and less than pleasant to be around, our family members who provided us support, and for some of us, watched our kids so we could attend class. Thanks, Mom. Our friends who made us stop studying and take an hour for that much-needed cup of coffee and time to reconnect with friends. Our classmates with whom we formed new friendships and provided each other with encouragement. And of course, our professors and advisors who challenged and mentored us through this process in order to make us better professionals. And without their support, this journey would not have been possible. Third, I'm thankful to have been given this amazing opportunity. I'm thankful to Metropolitan State University for creating these high quality and flexible programs, which allowed many of us, myself included, to continue working while we earned our degree. I'm also thankful because very few people get this opportunity. Very few people get an opportunity to pursue a doctorate degree or a graduate degree, much less a doctoral degree, so we must be thankful that we were lucky to be one of those individuals. Fourth, I'm thankful for all the spare time I'm going to have, or at least I hope to have. Earning a doctorate degree in any field is daunting and requires a large investment of time. I encourage you to go out and do that one thing you've been putting off until you were done. Maybe that means finally learning how to play the guitar your dad gave you for Christmas 3 years ago, right, Dad? Or taking that vacation, getting more involved with your church, volunteering at your children's school, or just binge watching a show on Netflix. Go ahead, do it. You have earned it. Lastly, I'm thankful for the opportunity this degree has provided me to make a difference in the lives of others. I'm an instructor at a four-year university, and although most days I swear what I'm just saying is not getting through to my students, there is always that one student who comes back and says thank you. For many of you, this will mean having the opportunity to take care of the sick or keep others healthy. For others, it will mean performing research that benefits the business community or medical field. To everyone in this room, please know that in some way, shape, or form, you are making a difference in the lives of others. And I encourage everyone, especially today's graduates, to go forward and to continue to make a difference. So in closing, as you receive your degrees today, I ask that you think about all you have to be grateful for. Thankful to be done, thankful for the people who stood by your side, thankful for this opportunity, and thankful for the opportunity to make a difference. Congratulations.
Thank you, Rachel, for your inspiring remarks. Now, the moment our graduates have been anticipating and for which they have worked so very hard, the conferring of degrees. This is the official recognition signifying their great academic and personal achievements. Graduates will be called forward to receive their hoods and medallions. To be sure that each graduate is appropriately recognized, to enable all members of our audience to observe the ceremony, and to ensure compliance with fire safety regulations, please stay seated. Keep the aisles and the front of the auditorium clear throughout the ceremony. A professional photographer will take photographs, and the graduates will be sent information about ordering their photographs. Also, please remember the acknowledgement of the academic accomplishments of the last graduate to cross the stage is no less important than the first. Therefore, I request at the conclusion of the ceremony, all graduates and guests remain standing during the recessional, and ushers will guide the graduates and you to the Great Hall, where a reception is prepared for you. Thank you for your cooperation. It is a long-established academic tradition that university officials congratulate graduates at commencement by shaking their hands. We understand that in our global community, there may be graduates who would prefer not to shake hands for cultural, religious, or health-related reasons. If you wish to shake hands, please indicate by extending your own hand to the greeters on the stage. If you do not wish to shake hands, simply do not extend your hand, and your preference will be respected. Either way, we congratulate you, and we celebrate your accomplishments. We will now have the presentation of candidates for their degrees by college, and President Arthur will confer degrees. So, will all the Doctor of Business Administration candidates meeting requirements for the doctoral degree please stand?
Crystal Fashioned. Crystal completed case study research which examined the physical operations of a healthcare facility type called long-term care. Long-term care refers to organizations that provide on-site nursing care for people with long-term illness, elderly people who need continuous medical supervision, or for those in long-term rehabilitation programs. Specifically, this research looked at the performance of the physical buildings and how this performance impacts external environment. Using the data from the nonprofit organization Practice Green Health, 33 facilities were reviewed in order to answer 2 research questions. What is the aggregate baseline of environmental performance at long-term care facilities? And as it relates to the question above, what can be learned by this data set that would lead us to define environmental key performance indicators that can be applied to long-term care sector more broadly? Based on this research, a model was suggested for future researchers interested in environmental performance of long-term care facilities. It suggests 6 reasons that long-term care engages in sustainability work: maintaining compliance with environmental regulations, identifying cost savings potential, participation required by parent organizations, marketing and media opportunities, perceived as doing the right thing for community and external environment, and the perception of an extension of personal and health and wellness. 5 environmental improvement categories were established: waste, sustainable purchasing, environmental health and personal wellness, energy, water, and associated environmental key performance indicators. Thank you, Crystal, for that great research.
Rachel London. The internet has transformed how tourism consumers gather information about travel destinations. In fact, the internet and the search engines in particular are one of the first places consumers go to the search for information about destination. In recent years, search engines have begun to incorporate social media pages into search engines' result pages, in short, SERPs. And these sites rank well on SERP due to their updated and relevant content. There have been studies that have addressed the impact of rank on SERP click behavior. However, there has not been a study that has addressed how rank of social media sites on SERPs influence click behavior. This study identified how the rank or position or destination marketing organization DMO website and social media pages on SERPs impact tourism consumers' click behavior on SERPs. This research specifically set out to test 3 things. First, it was intended to identify whether tourism consumers click on search engine result because of the rank of the result or based on whether the result was a DMO website and DMO social media website. Second, this study examined the impact of rank, title, URL, and meta description on an individual's click behavior. Third, the impact of demographic features such as gender, income, and education on click behavior was explored. Lastly, this study examined how consumers perceived credibility on reviews posted on the travel review website and social media sites influenced click behavior on SERPs. The research questions in this study was answered using 3 main statistical methods, including chi-square goodness of fit test, chi-square test of independence, and multinomial logistic regression. Research from the study indicated that there is a difference in the number of clicks on DMO website and DMO social media sites. Additionally, there is a difference in click behavior between men and women. Lastly, this study found that perceived credibility of destination review posted on the social media website impact SERP click behavior. Congratulations.
Thomas Meyer. Media naturalness is the relative similarity of a communication medium to the face-to-face medium. Media novelty is the relative difference of a communication medium to the face-to-face medium. Media naturalness theory and other interdisciplinary approaches include evolutionary psychology and behavioral economics to provide the basis for assessing the efficiency and effectiveness of communications media by knowledge workers. This original research adds to the existing body of knowledge as an empirical analysis to examine the perceived media naturalness by knowledge workers. The study was conducted by adapting the methodologies used in previous research and measuring the perceptions of media richness by knowledge workers. It sought to advance the understanding of significance and significance of naturalness in media use by distinguishing naturalness from novelty. The results of the study serve as a basis for further hypothesizing about media usage by knowledge workers and taxonomies of media. The actual and opportunity costs of media use to organizations and individuals were also discussed. Please discuss that all with Tom later today. Thank you, Tom. Congratulations.
I now ask Interim Dean Judith Graziano, Dr. Ruth Stoss, and Dr. Joyce Bredesen to come forward. Will all the Doctor of Nursing practice candidates meeting requirements for the degree please come forward as well?
Katie Bodie. Katie's DNP project was to identify an evidence-based quality of life assessment tool to implement into the enrollment process at an adult day center. The RAND SF36 item health survey was identified through a review of the literature as an appropriate tool to assess members' perception of quality of life. The assessment was given to new members entering the program and again after 3 months of program participation. Social functioning is noted to be a subscale closely linked with quality of life. This subscore increased from baseline to reassessment scores. Although this tool may not be the best fit to measure quality of life in this population, knowledge gained is helping to guide a future DNP project. Mardia Jaffer. The goal of Mardia's DNP project was to increase the utilization of the existing diabetes nurse educator to improve diabetes management at a local international urban clinic. The findings suggested that the providers have limited knowledge about the roles and benefits of the diabetes nurse educator. Education was created and is disseminated to the providers to emphasize the value of the nurse educator would add to their patient's diabetes management. Primary conclusions drawn indicate successful patient education about diabetes disease process, lifestyle modifications, and medication adjustments by a diabetes nurse educator or pharmacist can significantly improve glycemic control. It is recommended that the cornerstone of good diabetes management is to work collaboratively with multidisciplinary teams in the care of diabetic patients.
Aaron Crosby. The number of medical interventions available for patients suffering from heart failure has increased significantly. Without engaging heart failure patients in advanced care planning discussions, patients may potentially endure more aggressive, life-sustaining measures than what they actually prefer. In an effort to stimulate discussions to promote early initiation of advanced care planning, Aaron's DNP project was piloted in a heart failure clinic. The project first identified the patients at increased risk of mortality and provided them with a heart failure specific advanced care planning tool to complete and return to the clinic. The study identified and mitigated barriers to those conversations and identified important relationships between a lack of advanced care planning and the presence of provider distress. Thank you, Erin. Laura Donatel. Severe sepsis and septic shock are a growing problem in this country, and Laura's DNP project, an urban emergency department, chose to model their care of these patients after the most recent and respected clinical practice guideline. The guideline focuses on rapid assessment and treatment of the infection and the systemic response, including microvascular collapse. Microvascular collapse contributes to multisystem organ failure and mortality. Fluid resuscitation is the first-line treatment for this condition in septic shock, but the facility's goals were not consistently met. Through an evidence-based multimodality strategy that included provider and nursing education, along with concurrent performance review and bedside reference materials, adherence to fluid resuscitation recommendations for these patients had a statistically significant improvement. Kenny Van Osdell. Kenny's DNP project was focused on building capacity for global health work at Metropolitan State University. The emphasis of the project was to prepare the initial groundwork necessary to developing ethically robust global health programs. Such programs should be based on the principles of social justice with a focus on building sustainable and equal partnerships with a responsiveness to the causes of inequalities in the partnering communities. Thank you, Kenny. Emma Verdeja. A quality improvement project was designed to determine if time to administration of analgesics of acute long bone fractures among adults could be improved to less than 60 minutes. Chart audits in an emergency department setting revealed significant delays in analgesia administration with median time to administration of 131 minutes. Qualitative and quantitative data were collected through pre- and post-implementation surveys, focus groups, and retrospective chart audits. An evidence-based practice workflow was developed as a guide for nursing staff along with multimodal education distributed. Median time to administration for analgesia post-implementation was reduced to 62 minutes. Overall, nursing staff were observed to be in support of the workflow in practice, with some laggards resist to change. The new education and evidence-based practice workflow will remain as part of practice and available for reference. Thank you, Emma.
Nicole Susan Dre. Nicole's DNP project was a mixed method exploration of student health at a small urban art and design college. She utilized the proceed model to build stakeholder engagement and gather student health information through a focus group and survey. Student health data was then evaluated with several stakeholder groups to plan a new health services department. Key recommendations include inclusion of health promotion, primary prevention, and mental health services in student health services. Catherine McGovern. Catherine's DNP project targeted increased provider intent to recommend the human papillomavirus immunization and in turn increase HPV vaccination rates in an ambulatory setting in the Minneapolis metropolitan area. The interventions from her project were implemented throughout the entire health system, and the results provided great insight for the organization on their HPV immunization practices. Mumbi Mungambi. The title of Mumbi's DNP project is Improving the Health Outcomes of Somali Women, a collaborative diabetes prevention project. The goal of this DNP project was to assess whether a culturally tailored diabetes prevention intervention improved the knowledge and changed the perception on diabetes, healthy eating, and physical activity among a group of Somali women in south central Minnesota. The project achieved its intended outcomes of raising awareness on the impact of diabetes on the Somali community and also motivating the participants to make positive lifestyle changes to prevent diabetes. Mumbi continues to be committed to advocating for optimum health incomes not only for African immigrants but all underserved populations. Ria Fofana. Ria completed her DNP project in an urban public health clinic in downtown St. Paul. She developed and implemented a human immunodeficiency virus pre-exposure prophylaxis program, also known as PrEP. Efforts included the development and implementation of staff and provider education and the creation of a clinic-driven protocol. As a result, their innovation of a multi-pronged PrEP program was associated with increased staff and provider knowledge and successfully established 14 clients in the PrEP program. Stacy Lukes Shrestha. Stacy's DNP project sought to improve the rates of brief tobacco cessation interventions in the primary care setting by enhancing provider self-efficacy. The project took place at a family residency clinic with high rates of tobacco abuse among adult patients. The DNP student provided targeted training to resident physicians in the hopes that familiarity with tobacco cessation education would increase provider self-efficacy, thereby leading to increased rates of intervention towards patients who use tobacco. Initial evaluations showed promising improvement in intervention rates as compared to baseline, but continued follow-up is necessary to determine long-term effect. Jamie Marie Goyle. Jamie's DNP project was completed at a pediatric hospital in Minneapolis. She collaborated with the emergency department and neurosurgery team to redesign a protocol that guides providers on obtaining diagnostic imaging for a pediatric patient who presents with symptoms of shunted hydrocephalus. Jamie educated the providers on the updated guideline, which expanded provider awareness and knowledge. Adherence to the guideline led providers to correctly identify the appropriate diagnostic imaging necessary, leading to a decrease in radiation exposure and increased favorable outcomes for pediatric patients. Jamie would like to give a special shout out to her daughter, Harper, who is celebrating her first birthday today. Ike Okachukwu. It has always been a passion of Ike to serve the underserved, and he had the opportunity to achieve this during his DNP project. His project involved the utilization of a patient-centered model of care to determine barriers and develop evidence-based solutions towards the re-education of high appointment no-show rates amongst a complex medical patient group. Although the project faced unanticipated barriers to reducing no-show rates, it was nonetheless gratifying to know he served as a patient advocate, promoting patient access to quality health care and better health outcomes. Ashley K. Welters. Ashley's DNP project took place in the cardiovascular intensive care unit at an urban pediatric hospital. She collaborated with interdisciplinary staff within the unit to create a checklist to better organize care at the bedside for the children who were being withdrawn from life-sustaining measures. Use of the checklist allowed staff to focus solely on the dying child and family, ultimately giving them a better death experience. The checklist was used during the implementation period and had a positive impact on staff confidence and comfort. Use of the checklist also increased staff communication and collaboration. Ashley will use the end-of-life care knowledge she gained throughout her DNP project as she begins her NP career with the inpatient palliative care team at Gunderson Lutheran in La Crosse, Wisconsin. Alicia May Schrepfer. Early detection and treatment of melanoma is crucial as metastatic disease can cause death. Patient adherence to follow-up recommendations is important to ensure disease prevention, early detection of recurrence, or a subsequent melanoma, and timely treatment. The purpose of Alicia's pilot study was to test the feasibility and utility of a reminder system to reduce the inefficiencies of the current melanoma recall system, an outpatient dermatology department, and to guide the design of a future registry. A pre-post mixed methods design was used to assess how the innovation compared to current practice to determine features of a reporting system that are user-friendly and reduce barriers to use. Pilot study findings can guide the design of the future dermatology registry to create an acceptable tool for clinical staff to identify patients with a history of melanoma due for follow-up. Sheila Newman. Sheila's DNP project, implementing firefighter discharge visits as part of standard plan of care for patients after discharging from a hospital located in a Minneapolis suburb. The firefighter discharge visit program was developed with an emphasis on community partnership that would decrease healthcare costs, improve patient experiences, and improve the pre-9/11 time frame. During the visits, firefighters reviewed the after-discharge visit instructions with the resident, completed a home safety assessment, checked the resident's vital signs, confirmed the resident's medications, and checked for functioning fire alarms. Although the intervention did not reduce readmission rates compared to usual care, this innovation helps to inform hospital discharge planning and utilization of resources in the community.
President Arthur, these students have completed all the requirements for the degree of Doctor of Business Administration and Doctor of Nurse Practice. On behalf of the faculty and administration of Metropolitan State University, I am proud to present them to you for the conferring of their degrees.
Will the graduates please stand? By virtue of the authority vested in me by the Board of Trustees of the Minnesota State Colleges and Universities System, and under its rules and laws of the state of Minnesota, I hereby confer upon you the doctoral degrees for which you are recommended, with all the rights, privileges, and responsibilities pertaining thereto. Graduates, you may be seated. Graduates, over the next few weeks, you will no doubt receive many well-deserved congratulations for your academic achievements. You have worked hard, and you should feel tremendously proud. But as we all know, most of you did not do this alone. The support of family, friends, employers, and communities are usually essential to bringing a student all the way through to graduation. Before we conclude, we must pause to acknowledge and to thank all of our family members, friends, and others who supported you along the way and who helped make your presence here this afternoon possible. To all of you here this afternoon who played that role, on behalf of these graduates and on behalf of the entire Metropolitan State University faculty and staff, thank you. Graduates, thank you for anticipating what I was going to ask you to do. And now, we ask our guests to please remain standing until our platform party, the faculty, and all of our graduates have marched out and the recessional is completed. After the recessional, our ushers will guide you to a reception in the Great Hall with our deans, faculty, and graduates. Metropolitan State University's Doctor of Business Administration and Doctor of Nursing Practice commencement ceremony is now concluded.